who Chief Dr. Tedros Adhanom's politically motivated initiatives. Everyone in a position of public health leadership should remain nonpartisan in their actions and decisions, especially during times of political conflict. Dr. Tedros Adhanom has faced repeated criticism since assuming the role of Director General of the World Health Organization, WHO. Some critics allege that his leadership has been influenced by political interests connected to Ethiopia's former TPLF-dominated government led by the late Prime Minister Meles Zenawi. They argue that ethnic-based political narratives have contributed to deep divisions within Ethiopia, including tensions affecting the Amhara community. Ethiopia's history, including the imperial era, the Derg military regime, and subsequent political transitions, has involved complex political struggles that have affected many ethnic groups across the country. There are also serious concerns raised by various observers regarding the conflicts in the Tigray, Amhara, and Afar regions, where armed confrontations have resulted in the loss of many civilian lives and long-term humanitarian consequences. These events continue to impact communities throughout Ethiopia. More recently, during the ongoing humanitarian crisis in Gaza, some critics have questioned the priorities and responses of international organizations, including the World Health Organization, WHO, particularly in relation to diplomatic engagements and high-level visits involving international figures from the United Kingdom. These critics argue that global institutions should focus consistently and transparently on humanitarian relief efforts and advocacy for affected civilian populations. International organizations, such as the World Health Organization, carry a responsibility to act impartially, prioritize humanitarian principles, and remain focused on protecting vulnerable populations. There are millions of children and seniors in Gaza and in Ethiopia's Amhara region who lack basic necessities such as food, medicine, and shelter due to ongoing political instability and conflict. Leadership within such institutions should demonstrate transparency, accountability, and an unwavering commitment to the well-being of those suffering from crisis and war.